Okie doke. Hello, I'm AJ. I'll be your student nurse today. How are you?
I'm doing good, sir. How are you?
Good. Could I get your name and date of birth, please?
Darian Johnson, September 27th, 1997.
Okay, awesome. And do you have any known allergies?
No, sir.
Okay, I'm here to teach you about your nitroglycerin patch, how to use it, and some other information about it. So a nitroglycerin patch, it's used to prevent chest pain. It doesn't stop chest pain once it starts. It's just preventive. So if you get chest pain like that, please contact emergency services. It prevents chest pain by decreasing the amount of oxygen that your heart needs. Some things about applying it. So with applying it, you want to put it close to the trunk of your body. So put it on your biceps, your thighs. Rotate it every time you use it. So if you use it on your left biceps, move it to your right thigh or other biceps. Dose usually lasts from 12 to 14 hours. So a smart thing to do is to write the time you applied it on the patch itself or set a digital reminder. Side effects include headache, dizziness, difficulty breathing, low blood pressure, and sweating. When you're prescribed it, please keep taking it, because if you don't, it could cause a coronary spasm, which is very bad. And when you're taking the patch itself, do not drink. It's a contradiction and it could make things very bad for you. So when you apply the patch to yourself, make sure you clean the area of the body you're going to apply it to and place it. And when it's time to remove it, clean it as well, because there are going to be residue from the adhesive and the medicine itself. And then same thing when you're going to apply it, clean it. When you take the patch off, be careful not to touch the center of the patch, because that could have the medicine on it. And when you get rid of it, just make sure you get rid of it in a way that no children or animals could get to it, because you don't want to poison them. So I have our handy dandy training aids here for nitroglycerin patches, and I'm going to demonstrate on myself how to use it. So first thing when you get it is you want to check the expiration date on the box, so make sure it's in use. And again, as I said, scrub the area, make sure it's nice and clean so it'll adhere no problem. Here's one for you. Here's one for me. So again, I'll apply it first to show you. So again, take the patch out, we check that it's in date. So what you want to do is take off one of the protective backings. And again, we clean the area, it's all good to go. Put it here on the one adhesive, and carefully, again, without touching the center of the patch, remove the other protective backer. Again, set your alarm, make sure we take it off in 12 to 14 hours, and very gently just press on the adhesive to make sure it's sticking. Don't massage the center of the patch. That's going to give you a little too much medicine all at once. And that's how you apply the patch. So if you could show me to make sure you know how to do it.
Understood, sir. So clean the area that I'm applying it to.
Yep.
Make sure the expiration date is all good and whatnot.
Yep.
Expiration date's all good. I open the package and whatnot. Take the bandages out, or the patch out.
Yep.
Take the one side off, make sure I don't touch the center patch. Area's already cleaned and whatnot, put it on the clean area, put the adhesive down, make sure the adhesive sticks. Try not to touch the center patch or anything like that. Make sure I grab the other end, and then put the other adhesive down, and rub on the adhesive, not the center patch, so I don't get too much of a dosage.
Yep.
And the patch is on, and all set. So,
And what you got to do to make sure you remember later.
so I'm gonna set a timer and whatnot, or if I have a marker or something like that, I'm going right on here and whatnot, and just make sure I have that
that's
time
awesome.
done.
And then again, just to clarify before I let you go out of my care, you know what it's used for?
Yeah, so it's used to prevent chest pain.
Yep.
If I'm already having chest pain and whatnot, I'll still have it, but it's to prevent it. If there are side effects to it, it's headache, dizziness, sweating, and chest pains.
No, that's you're preventing that. But you were right. Headache, dizziness, difficulty breathing,
Difficulty breathing. That's
low
fine.
blood pressure.
Okay. Yeah.
Well, yeah. Sounds like you're good to go. Again, if you have any questions, you can ask me now or can contact your local healthcare provider.
Okay, understood, sir. Thank you very much.
Have a nice day.
You too. Stay safe.
You too.